very good morning to you, dear listener, and thank you very much for joining us on today's edition of Perspectives. Our deep apologies for bringing you the program behind schedule. Kindly bear with us. It is due to circumstances beyond our immediate control. This morning on Perspectives, we shall give a sensitization on monkeypox disease. Already, the Africa Center for Disease Control has declared monkey health disease as a public health emergency, given its growing outbreak on the African continent. Cases have been recorded in at least 13 African countries with over 500 deaths across the continent. Nigeria has also recorded index cases in some states, and we shall give a sensitization on this disease, what are its causes, ways of preventing it, and how the public we take precautionary measures so as to avert this disaster as it is already raised as a public health emergency. I've been joined here on Perspectives by a consultant public health physician who is also the chairman Association of Public Health Physicians in Benue State. He is a consultant public health physician at Benue State University Teaching Hospital, Makudi. Dr. Teka Bito is our guest on the program. Welcome to Agate Radio, Dr. Bito.
Thank you so much for having me.
I am Nathaniel Nongo. Without delay, we'll start and later on we'll avail you the other platforms through which you can participate on the program because we are starting behind schedule. Dr. Bito, what is monkeypox?
Thank you so much, and I really want to appreciate Agate Radio for this sensitization. Monkeypox is a disease caused by the monkeypox virus, and it has effects on the human body, leading to things like rashes. There's usually a rash, usually starting on the face and goes to other parts of the body, including the palms and soles of the feet. There's fever, headaches, muscle aches, feeling of weakness, swellings of the glands, some in the armpits, in the groin, and other parts of the body. So that's monkeypox when you have this combination of signs and symptoms, also followed by exposure to the disease.
Okay, so basically, what is the cause of monkeypox? We understand it is a zoonotic disease. Help us understand its cause so that we know the context of the zoonotic disease that it is about.
Thank you very much for that question. Zoonotic diseases are diseases that can be transmitted from an animal host to man, and after that it can also be transmitted from man to man. And the monkeypox virus can actually stay alive in the body of animals, vertebrate animals, as well as the human being. So we are concerned because we need to control it both in the animal population and the human population. In addition, the virus can also thrive in the environment. That means inanimate objects like beddings, clothing, tables, surfaces can also be infected with the virus. And when people touch them and don't do proper hand hygiene or cleaning of surfaces, it can lead to the disease. So the zoonotic disease is of great concern because we are bothered about the transmission of the disease in animal population as well as in human population. And this is tricky because if we don't do well on both sides of the divide, then we can lead to an epidemic that we are unable to control effectively.
Okay, so its mode of transmission now being a zoonotic disease, how is it transmitted to human?
Yeah, it could be transmitted from the animals to human beings. In this case, some occupations are higher at risk, like hunters, like butchers, people who handle the meat, and then also people who eat, like a dead animal that's dying from monkeypox disease. If that meat is consumed, that could lead to infection in the human population. So touching of these animals, it needs to be done with a lot of hand protection, washing of the hands, proper cooking of the meat to appropriate temperatures, and then also ensuring that the areas where these animals are killed and taken care of are properly cleaned so that we don't leave opportunities for transmission. Also, when man is infected, he can also transmit it to another person. And this could be by touching. Things like hugging, you know, shaking of hands, even kissing, as well as having sex, both all forms of sex. Yeah. And this could lead to infection. Also, when the beddings, maybe the bed sheets of people who are infected, or their clothes, or the surfaces they touch, have the infection. When they are touched by someone who is uninfected, it can lead to transmission. In addition, when people who are affected sneeze or cough or talk or sing, people who are in close contact with them may be infected because aerosols can actually lead to transmission into the respiratory tract. So to prevent, we also ask those who are affected to use a face mask to reduce transmission through that means.
Okay, back here in Nigeria, the Nigeria Center for Disease Control and Prevention yesterday revealed that Nigeria recorded at least 39 confirmed cases of mpox. Help us understand some of the states that have been affected and the confirmed cases. Are they fatalities?
Yeah, the NCDC has been doing a great job, providing regular situation reports so that public health experts and the general public can take appropriate measures to prevent and control the disease. The number of cases is actually spread across many states, including Benue State. And there have been about, like you said, 39 cases since the epidemic weeks in 2024 commenced. So the states include Benue, in Abuja, in the north central region, majority of the states in the south region, and the southwest we have Lagos State. Lagos had been the epicenter for the last epidemic, where they had the highest number of cases, and then Oyo states. So about 19 states currently have the confirmed cases of monkeypox. The states that we may say do not have confirmed cases, we may actually link it to surveillance, meaning that an active search for disease. That means, before you get a confirmed case, it means that there are suspected cases. And in Nigeria, we have over 700 suspected cases, that we have these 39 cases. So if the job of surveillance, that's actively checking, to find out if there's disease and doing the testing, the tests of the skin lesions, probably we may find more cases.
Okay, when you mentioned also in Benue that the Benue is a confirmed case.
Oh yes, we have confirmed cases in Benue State.
Okay, and how is it being managed? Is there any active surveillance to do more of the search for it in any of our rural communities?
Yes, the State Ministry of Health, the Emergency Operations Center, and all health workers are involved. When there's a suspected case, the alarm is expected to be raised, even by rumors at the community level. Then a cascade of events are activated to ensure that tests are done to either confirm the case or to identify that it's not a case. So that's how it needs to actually be, the feedback from where there's a suspected case needs to be escalated so that the Emergency Operations Center can actually activate collection of samples to verify whether there is actually a case of monkeypox or not.
Okay. Based on public information available, there are about 2,863 confirmed mpox cases and 517 deaths across 13 African countries reported only this year. On a general note, what is the fatality rate of monkeypox?
Yeah, the fatality rate of monkeypox is actually not as high as other zoonotic diseases, Ebola when compared to Ebola and Lassa fever. That's not to say the burden of the disease is not a challenge, because it causes the rash, and that could be disfiguring. It starts from the face and goes to other parts of the body. So it is of concern, and that's why the World Health Organization declared it as a public health emergency of international concern. You know, the epicenter is the Democratic Republic of Congo, and the disease has spread to many of the neighboring countries here, like you said, including Nigeria. So, a lot of public health measures. This actually would cascade a lot of public health measures to prevent awareness, like what we're doing on Agate radio, to ensure that people know the signs to look out for or symptoms, and know exactly what to do when there's a problem, so that they can go to the nearest health facility, get care, and also proper diagnosis be made if it's mpox. And then we'll talk about things like isolation, so that we can reduce the spread and also contain the disease.
Okay, which is to say, mpox could possibly be managed through isolation.
Absolutely.
Okay, let's get to delve deeper into its symptoms.
Yes.
What are those symptoms that one who comes down with monkeypox manifests?
Yes. The symptoms include fever. That's the feeling of hotness, intermittent with coldness of the body, some aches, headaches, muscle pains, weakness, tiredness, feeling of fatigue. And then these ones are also associated with the rash that is classical from the face, starts on the face and then spreads to other parts of the body. And this rash can also be found on the palms of the hand, on the soles of the feet. So it doesn't spare any part of the body, it can be anywhere. So given that other rashes also have this similar pattern, it's also important to do a test. And the test is actually to take a sample from the lesion on the body or the rash to identify whether it's monkeypox or not.
All right, dear listener, if you are just tuning in, you are listening to Perspectives on Agate Radio. We are giving a sensitization on monkeypox disease, an outbreak of it across the African continent, including Nigeria. And leading the conversation here in the studio is a consultant public health physician at the Benue State University Teaching Hospital, Makudi, who is also the chairman, Association of Public Health Physicians, Benue State Chapter, Dr. Teka Bito. Later at 10 o'clock, you can participate on the program by calling in on 0814-335-9292. 0814-335-9292. Send us an SMS or a chat on WhatsApp to the number 0912-699-9404. 0912-699-9404. Please remember to include your name and where you are sending the location where you're sending your message from. We are available on social media platforms. You can download the Agate Radio and TV app from Google Play Store, and as well, if you'll find us on Radio Garden to listen to us. Dr. Bito, public health emergencies, such public health emergencies.
Thank you for the question, and I would link up to the last emergency, the public health emergency of international concern that we had, COVID-19, and we remember how Nigeria acted. I would say Nigeria did very well. That's because when you compare the morbidity, mortality, as well as the access to vaccines and other commodities that were available at our disposal at that time, we actually did well. That's not to say we're going to rest on our oars. We can always do better. The room for improvement is the largest room. So we are doing what we can do, but there's a lot of room for improvement. That means risk communication, helping people to know the extent of their risk, and also engaging the community effectively so that the community can identify problems and seek care immediately, not to feel that these are other causes, these are spiritual causes or cultural causes, and, get into more complications. Also, to understand how to manage it, get to the healthcare facility, isolate either at the health facility or at home, and also do all possible to prevent spread of the disease. So to the extent that we're sharing information, we're equipping the health facilities, giving adequate information to healthcare workers to stay safe, to prevent transmission to themselves, to their patients, and ensure that the health system is actually optimally functioning. That's also something that is important in managing public health emergency of international concern, like monkeypox.
One would be wondering that with the emergence of monkeypox, recently Nigeria was grappling with cholera, and now we have monkeypox coming at a time when we are yet to recover from the episode of cholera. Can we survive it?
Absolutely, we can. Every outbreak or public health emergency gives the health system an opportunity to improve on itself. You know, many of these epidemics are not things that happen by happenstance. No, they are things that we are certain will happen. We have seasons. Cholera, once is the rainy season, with water and, contamination. We know that there will be episodes of cholera. So we know that we can plan, we can prevent, and we can build back stronger, such that the next epidemic would be far less in terms of morbidity and mortality to the system than the previous one was. And then when we also have an epidemic not finishing, then you have another epidemic coming up. It's still an opportunity to build back stronger, help the system to be stronger, provide resources where they need to be, provide critical manpower where they need to be, to ensure that the round pegs are in round holes. Capacity at the Public Health Emergency Operations Center, at the Department of Public Health in the state, at all health facilities, at the tertiary levels, the secondary levels, and the primary levels, so that we have our health being our own primary concern, and we are doing exactly what needs to be done to keep the entire homes, communities, and inhabitants of Benue State and Nigeria by extension safe.
Okay, Mpox, how is it managed medically? Is a vaccine preventable?
Yes, Mpox, there's basically we give health education, right? That's to help people understand their risk and also manage it. Then we also have something that can help people for specific protection, which is the vaccine. The vaccine is available and is also given based on the public health risk that's available. In addition to that, we manage the conditions that people face on an individual basis. So that's why we ask that those who have similar symptoms, like I've talked about earlier about Mpox, to go to the nearest healthcare facility, meet their doctor or healthcare provider, and get care and follow the advice, because we usually give advice if we're not admitting the client on what to do at home, depending on severity of the condition.
Okay, if the vaccine is available,
Yes.
can one just walk into a health facility and get to take it, or is when you are infected with Mpox that you are administered the vaccine?
Okay. Usually, decisions about mass vaccination are carefully decided based on risk. Public health evaluation is done and say, okay, fine, we're having this problem and there's a risk of spread. And because of this area is maybe an epicenter, so we need to provide this vaccine for everybody to take. Like when we had COVID-19, remember, the vaccines were given to everybody apart from children. Yeah. So for Mpox, we have not reached a level where we are giving mass vaccination to everybody. But as situations unfold, we'll get guidance both from the states, the NCDC, and also the WHO about implementation of mass vaccination for prevention of monkeypox.
Okay, but wouldn't it be appropriate for thinking to be done in the direction of mass vaccination, given the ravage it is assuming already 517 deaths recorded just this year, though it's spread across countries? Is it not the appropriate time the vaccination should commence?
Thank you very much for your question. When we talk about the cases, okay, like we said in Nigeria now, for this 2024, we have 39 cases, right? You
Yes.
gave that statistic exactly.
Yeah, 39.
39. So with 39, we usually wait in public health. The risk. Are we going to start mass vaccinations now? Even when we talk about mass vaccinations, we're also thinking about the source of the vaccines. How readily available are they? They most likely will be deployed to areas that have active problems and are the epicenter than areas that are not. So the point I'm trying to make is that a lot of public health discussion is going on, and mass vaccinations will start exactly when they are supposed to. So we should not be bothered about that.
Okay, so in the interim, what are those precautionary measures that the public need to adapt so as not to contract mpox?
Thank you very much. Prevention is always better and cheaper than cure. So I'm grateful for this question, and we trust that our listeners would pay attention and do the needful. When we talk about the disease being caused by contact, one very easy thing we need to do is wash our hands. Wash your hands when you're not sure if you washed your hands. Wash your hands always. After shaking someone, contact with an inanimate object, a table, and all that, going to the toilet, we wash our hands. And the washing of the hands is not just putting soap and rinsing, no. It's about wetting the hands with water and then getting soap and then making it to lather and washing it palm to palm, then palm to back on one hand and on the next hand. Then washing the hands by interlocking the fingers to wash the interdigital spaces appropriately. After that, to wash the thumbs on each hand, following each other, and then to wash the tips of the fingers in the palm of each opposing hand, one after the other. Then to oppose the fingers and wash the knuckles appropriately. Then to wash the wrist and to rinse the hand under running water and to air dry. So those are the steps to appropriately washing the hands effectively. And by washing the hands, we are preventing transmission, because if the monkeypox virus is on the hands and the hands are washed effectively, transmission is drastically reduced. Also, we talked about transmission occurring through sexual contact as well. So we can have people sticking to their own partners and not having sex that is not protected. In addition to that, we also talk about people who have a condition. We expect that they should use face masks so that the virus in their respiratory tract is unlikely to infect someone who is in close contact with them when they are either talking, sneezing, singing, and all that. And then people who are infected should also be isolated. If they are receiving institutional care in a facility, then they are in the isolation ward and they stay there so that they are unlikely to transmit the virus to other people. And then the contacts of people who are infected need to also be under surveillance and provided their tests and care so that if they come down, they also are unlikely to spread to others as fast as could happen. Also, those who are sick need to go to the health facility promptly. People who have rashes, usually starting on the face or going to other parts of the body, headaches, fever, muscle pains, lethargy, swellings, either at the jaw, the armpits, at the groin, behind the knees, any of the lymph nodes of the body swelling, yes, go and receive care at the facility, and a test will be done to know whether it's monkeypox or not.
One will also be wondering that, is there every meat now that we can consume, given that it is zoonotic?
Very correct. That's also a great preventive measure. People who handle meat need to be careful. And this is not the time to, because you want to make money, sell dead meat. No, dead meat should be thrown away, discarded. Also, those who handle meat need to do effective personal hygiene, washing of hands, cleaning surfaces so that transmission is very unlikely. And then we should also cook meat thoroughly and properly, not half done meat. No, all meat needs to be cooked thoroughly, such that if there's any disease causing agent, it is eliminated by the heat to prevent any form of transmission to humans.
But as the chairman of the Association of Public Health Physicians, has there been emergency centers activated in case of a mass outbreak of it in Benue, for instance, where you are the chairman?
Yeah, we have a public health emergency operations center at the State Ministry of Health, and the emergency operations center coordinates all around the state public health emergencies. So yes, we have a functional public health emergency operations center, and it's not like when there's an outbreak we form another center. It's a single public health emergency operations center that is manned by a very qualified state epidemiologist who has critical understanding and capacity to manage this with experience, such that concurrent action can be taken for multiple threats to public health in the state.
Okay, but at the moment, like the case you mentioned that has been confirmed in Benue,
Yes.
surveillance has detected that further cases have been confirmed, or is just how many cases do you have an idea?
Okay. The last count I had, it was about 7 in Benue. Okay. If you check the map, you see that Benue actually has confirmed cases.
Okay.
And when you talk about surveillance, surveillance strictly means that whenever there's any rumor or any information that someone has a rash at whichever location, the response team is deployed there to investigate and also take samples to find out whether it's a case of monkeypox or not. So if rumors come out at 5 local governments at the same time, then capacity needs to also ensure that all those 5 different cases, or even at multiple locations in local government, need to be checked, and samples taken to confirm or otherwise to protect the public health of the state.
Okay, as it is now, even international travel advisories, part of what NCDC talked about yesterday, is there any robust mechanism to check those who are coming into the state or generally international travels?
Yeah, for monkeypox, we don't have advisories for restriction of movement yet. Notwithstanding, if anybody has any of those symptoms and the person is in transit, the public health team, either at the border, land border, air border at the airports, or at the water borders, would actually do their own management to identify, to screen, and do the tests. And if it's positive, obviously that person will not be allowed to move across the border. The person will be isolated to receive care until when they are disease free before they can move, to prevent them spreading it to other people and also protect our health.
All right. The program, its perspectives are focuses on sensitization on monkeypox disease. You can participate by calling in on 0814-335-9292, 0814-335-9292. Once you connect with us, we'd like to know your name and where you are calling in from. Then keep your submission very brief. Send us an SMS to 0912-699-9404, 0912-699-9404. Remember to include your full name and the location you are sending your message from. You may log on to our website on www.agateradiotv.com to listen to us, and every other social media platform we're available there. Good morning.
Hello, good morning.
Good morning to you.
This is Vincent calling from Northbank.
Okay, good to have you join us, Kwaza Vincent.
Yes, this is the doctor in the studio. Yes, I want to ask a question. The doctor made mention of the symptoms of this monkeypox. and that are related to any other sickness, like tiredness, fever, and the rest of hotness of the body. So what could be the differences? That is the specific symptoms that one will exhibit that will be able to identify that this is monkeypox different from any other disease. The particular differences that will show that this is monkeypox, this is other disease. And I want to add in this way my contribution. Another one is, you see now that this monkeypox has been identified in some of these other states, it is very important for NCDC to put surveillance in this our motor park. Those people traveling from other states to our state, let them station them in this motor park so that once people from another state arrive a particular state, there will be a kind of a check before they will go into the normal activities in the state. So that is my contribution.
Okay, thank you, Vincent. Thank you very much. We'll respond to your question. And anyway, in terms of surveillance, the other issues we raised. Hello, good morning.
Good morning, sir.
Welcome to Perspectives.
Thank you. My regards to the doctor in the house.
Thank you.
I am Mr. Ondachi Gabriel from Ojakwa Madoka.
All right.
In the local government area.
All right. Good to have you join us, Ondachi Gabriel.
I thank Agate Radio for taking the lead in sensitizing the public all the time towards anybody that is happening in the public. God bless Agate Radio for that.
Amen.
It's very unfortunate that despite facing all this hardship in our country now, it has been happening from the past, right from COVID-19 down to this other disease that come to us. This very one that is coming very rapid, as we heard it from other African countries, like you said, the government is that though it is not forced that they have to support travelers now, but what they should do, like they have compared everybody to wear this face mask in the past, let them go back to that system again, to let any traveler at all, even if you are not traveling, if you stay at home, and the doctor has said, if you are staying at home, wash your hands, and after washing your hands, you wear your face mask in order to remind the other people who are not having it to have their own. That prevention is better than cure, they say.
Okay.
That if we cannot cure this, we can prevent it from doing or attempting the way the doctors help us to sensitize us.
All right.
So I want the government to send even people to rural areas who are not even listening to Agate Radio or any other information, so that they can inform the people that they should wear their face masks, wash hands all the time, and then prepare for get away from dirtiness.
All
and
right.
there's another dangerous thing that we see first. When they eat the bones and throw it to the dogs they say it is zoonotic. These dogs, they carry this bone and take it, not knowing that it is being affected. And when it comes to any other person, the person can be affected. So
Okay.
we have to be careful with the pet dogs we have at the home now too.
All right.
Thank you, sir.
Thank you very much, Ondachi Gabriel, for your concerns. Anyway, we will get to understand whether dogs are also at risk. Hello, good morning.
Good morning, sir.
Welcome to Perspectives.
Good morning.
Hello.
Okay. Hello, sir.
Yes, you are on. Your radio is too close to you. If you move away from it, it will be better.
Okay. Okay. Let me move away from it. My name is. Okay, my name is Brother. I'm Brother Mekoji.
Okay, Emeka Oji, please, you are on. Speak to us briefly.
I'm calling from Welfare Quarters.
Thank you very much.
Okay, I've been listening to the doctor. Especially, I became interested when he was stipulating some of the preventive measures, like handling meat, washing hands, and all that. And me being a Bible student, it really caught my interest. What I say so is that Now we are in the modern era. Human beings, at a point in time, we resorted to what they call scientific rationalism. Everything must be scientifically proven and taken care of. But if you go back to the Bible, you read Leviticus 11 and Deuteronomy 14, there are so many animals the Bible has forbidden us from eating. And handling of dead animals and all those things are stipulated. So the point I'm trying to make is, they say prevention is better than cure. The one who created us, created the world, has given us all these preventive measures. But somewhere along the line, it was deficient for scientific approach. So my advice to people, things like monkey, rat, pig, uh, larva, this is they weaken the immune system. I see at the end of the day, any little disease can knock us off. So the to me, the the right approach is for us to try to strengthen our immune system
Okay.
by eating rightly and living well.
Okay.
So
Thank you.
this idea of uh, vaccination, as you mentioned, I remember the COVID-19 era. Many people who took that vaccination, they are having a lot of problems. So me, I'm very, very one of those who expressed hesitancy
And
with vaccine. So
thank you,
though
Emeka.
the doctor is there, he will know better. But I've been reading much about the effect of COVID-19 vaccine, and
That's not
I'm
our
not too
focus.
happy about it.
Thank you very much. We appreciate you. The effect of COVID-19 vaccine is not really our area of interest. We are interested in the new issue, which is monkeypox. So narrow your conversation to that. Hello, good morning.
Good morning, sir.
Welcome to Perspectives.
Yeah, Dondover James from Mapa in Bok local government of Benue State.
Okay, good to have you, Donduve.
Yeah, thank you so much. My regards to the doctor in the studio. He has spoken very well. I must appreciate Agate Radio for giving us the sensitization. And when things of this nature are coming, they are in the forefront to advise people and make them be sure that something dangerous is around the corner, so that they will take measures to curb issues of this nature that are life threatening. So, concerning the issue, I am just going to advise our people that they should take advices seriously. If you hear it from Agate Radio and from any other media outfit, you can tell others, because it is real. Most of the times our people, they try to, crack jokes with issues like this, because I met one person who was telling his other relative that he would go to the market and buy Lassa fever, meaning he was going to buy rats. You understand? Things like that are not to crack jokes with. When something is getting down with people 6 feet down and you are cracking jokes with, it's not a good thing to do. So I advise our people. And as the last caller has said, truly the truth of the matter is that God has created this world and has said that some animals are forbidden. They are not good for our health. If you go to Leviticus 11 and Deuteronomy chapter 14, there are certain animals God says we shouldn't eat. But this modern world that knows more than the Creator are making things difficult for us, because all these genetic animals, their root cause is from animals. And these animals are always those that were forbidden by God. God says only animals that chew the cud should be eaten. So people should take God's advices also seriously.
Okay.
Thank you, sir.
Thank you, James. Thank you. We appreciate you. Our callers are sounding very spiritual.
Yes.
Anyway, this is a good one. Good morning.
Hello, good morning. I'm Peter Taylor calling from North Bank.
Okay, Peter Tena, good to have you.
Yeah, and for the issue of this
Please move away from your
monkeypox.
radio set or turn down its volume.
Okay, for the issue of this monkeypox, and is there any vaccine, like for those of people that rear animals? Is there any vaccine that can be given to them so that they can vaccinate their animals in order to prevent them from having monkeypox? And the second question goes this way: what is the lifespan of this monkeypox? Like when it is exposed on items, like maybe table and other items like that.
Okay.
Thank you.
Could that be all from you? Okay. Thank you very much.
Yeah.
Thank you. All right. We'll speak to some of that. The line is still open 0814 335 9292. The line for SMS is 0912 699 9404. Good morning.
Morning, sir.
Welcome.
Sir, please, can I make a complaint to Agate Radio?
May we know your name and where you are calling from? Is your complaint related to the subject we are discussing?
My name is Samuel from Sekave Village, behind Thomas Secondary School, Nakaro there.
The name is who?
Samuel.
Samu who?
Samuel Adiku.
Okay, where are you reaching us from, Samu Adiku?
From Nakaro Road, behind Thomas Secondary School,
All right.
Sekave Village.
Okay, you say you have a complaint. Is your complaint related to the subject we are discussing on our program, Perspectives, which is a sensitization of monkeypox disease?
Yes, sir.
All right, if it is not, please reach us through another platform. Thank you so much. Thank you, Samuel. You can send us an SMS to 0912 699 9404. Samuel, I hope you are listening. 0912 699 9404. Just send us an SMS and we will attend to your complaint if it is related to Agate Radio. Dr. Bito, let's respond to some of the concerns raised by the callers, beginning with Kwaza Vincent, who asked how the symptoms could be differentiated between those of mpox and every other regular symptom. You listened to him.
I did.
Yes.
So thank you, Vincent, for your question. Yeah, the thing about monkeypox is the symptoms that he has. Other diseases have similar symptoms, like chickenpox, where there is a rash. Also, you may have other diseases that don't have rash, but have the fever, the weakness. Even malaria could have similar symptoms, okay? Weakness and body aches and headaches. So that's why in health, we check by asking the patient what the problems are. We do an examination, then we do laboratory tests. So the lab tests are very critical to identify whether it's monkeypox or not. So monkeypox is not a disease that you can look at the symptoms and be certain 100% whether it's monkeypox or not. Even the rash, the rash usually starts on the face and then goes to other parts of the body. And then it also affects the soles and the palms. I think some other causes of rash don't affect the soles and the palms. But you can't just use that to say it must be monkeypox. You need to do the confirmatory test of the lesions, that's of the rash, to identify whether it's monkeypox. Surveillance needs to be done everywhere. Everywhere. No motor parks, yes, for travelers, no doubt. If someone has a rash, yes, that person can actually be investigated further, And if feedback is given to people who stay at public places, including motor parks, when someone is looking or has some of those symptoms, they can raise a red flag, and then the surveillance officers can also come around. So thank you very much, Vincent, for your feedback.
Okay, Vincent, I hope you are listening. I'll be back shortly. Good morning.
Good morning, I'm Radio.
Thank you for joining us.
This is Teresa from Opposite College of Health Science.
Teresa who?
Izungu.
Okay, thank you so much, Teresa. We're listening to you.
Okay. My regards to the doctor who is giving us the sensitization. And my question is, this monkeypox you are talking about, does it have any other name that is so common?
Okay.
Hello.
Yes, we're with you, Teresa. We're listening.
Okay. And another contribution I have to give is, this listening to radio. Some people find it very difficult to listen to the radio. So my advice is, if you can sensitize this monkeypox like in the churches, the mosques, and other means, so that people will get to know. Because we find it very difficult that you go to many people, they don't listen to the radio. So if you would do that, it will go a long way to help. Thank you. That's my contribution.
All right, thank you so much for your contribution, Teresa. All right, we are taking the lead. Agate radios giving a sensitization as part of what more persons or yeah, okay. Tina from North Bank sought to know what is the lifespan of the mpox virus and the vaccination. We talked about vaccination, but maybe as a refresher, particularly the lifespan of the virus. Tina from North Bank asked to start.
Very well. So thank you, Peter Tiena, for your valid question. For the virus stays a few hours and is still patent. You know, we talked about the environment also leading to infection. So if the fluid that contains the virus is still there, the virus may live a little longer, you know. But if it's just naked, it will live a little shorter. So it's difficult to say this is the exact time that a virus will stay patent, so that you not say after this time, this place, even though it was infected before, I can't get infected. It's difficult to do that. So basically, it is a lot of prevention, having a preventive mindset to ensure that the hand washing, surface cleaning, personal hygiene is top notch or at the highest it should be, so that infection from the environment is reduced to the very barest minimum. Okay.
Okay, so Tina, I believe you are listening. Oh, in a moment, Doc. Hello, good morning. Hello. Good morning. You are on. Speak to us. Okay, the line is still open. 0814-335-9292. Teresa, you listen to Teresa as well.
Exactly.
Okay, address her concern whether there are other common names that mpox, monkeypox is known with.
Thank you very much, Teresa, for your great question. You know, communication is key, so it's important to know as many nomenclature or names that we can classify monkeypox with, so our listeners would understand. A common other name used for monkeypox is mpox. That's just the summarization of monkeypox. But I'm sure we also have names for monkeypox in our various dialects, and I'm sure that will be very useful at the community level. So even though I don't have all the names of monkeypox in our regular dialects, I'm sure that our health practitioners have those exact names, such that when we are saying it, you can say, okay, yes, this is it, or that is it. That's the response I have for you.
Okay, so Teresa.
And also, sir, in
yes,
addition,
yes.
Teresa said something that is very important, appreciating Agate Radio, and also requesting that you shouldn't stop there. And I agree, everybody has a stake to play in our churches, in our mosques, at our youth meetings, adult meetings, you know, everywhere people gather. We should spread the word about monkeypox, prevention and control, so that all of us are safe.
All right. So please be a part of the sensitization. Hello, good morning. Hello. Okay. The line is open 0814-335-9292. Good morning.
Hello, good morning, sir.
Thank you for joining us on Perspectives.
This is Engineer Ike calling from North Bank.
Okay, who?
Engineer Ike Augustine calling from North Bank.
All right, good to have you join us.
Thank you, our anchor person. We really appreciate this topic. And you said the thing is a viral infection or it's a viral disease. Now, the little I know about biology is that viruses are possible, they are capable of being even crystallized. That is, they can stay out of fluid and being crystallized, and they can stay even for very long periods. So I think it will be better, I'm not a specialist in biology anyway, but it will be better to assume that it can stay so long. So the best precaution for me that I can advise the general public is that since it has to do with contact, we should go about with our hand sanitizers and as well try to keep a social distance. Thank you very much.
All right, thank you, Augustine. Thank you. That you are not a specialist in biology, that is why we have a specialist, a consultant public health physician. So we will rely on what he has told us about the survival of the virus. Hello, good morning. Good morning. Unfortunately, you're not forthcoming. We really cannot get to hear you. Good morning. Hello. All right, the line is still open. 0814 335 9292. 0814 If you're not able to get through to the line, send us an SMS to 0912 699 9404. 0912 Once you send an SMS, remember to add your name and the location you are sending it from. There too will get to entertain your concerns on the program. Good morning. Hello.
Good morning.
Morning to you. Welcome to Perspectives.
Thank you. This is Mr. Benjamin Agate calling from Yaba, North Bank.
Okay, good to have you join us, Benjamin.
Honestly, I want to appreciate Agate Radio for this program, and especially the doctor that has been with us, giving us lectures on this monkeypox. My only contribution is only to advise the public that it is that the doctor has said it all, and we always believe that obey is better than sacrifice. So let us hearken to whatever the doctor has said. Keep ourselves clean. Africans believe that they kill Africa, but that is not really. It is not real. So cleanliness is next to godliness. So we must be prepared to keep ourselves clean and abstain from all those things that doctors have as instructed. And I also want to advise that more sensitization should be taken to the public places. I know somebody has suggested it, and I've just heard it. So I know it will be done to the churches and market areas and other places, because it's not everybody that listens to the radio. So thank you very much. God bless you.
All right, thank you, Benjamin. Thank you. I appreciate you. It's not everybody that listens to the radio. If the message reach you, please help step it down too, which is why we are here on the radio, to ensure that the message reaches every nook and cranny of the state. All right. Dr. Bito.
Yes.
You said an emergency operation center is usually active at the ministry, but anyone who is coming with such symptoms, what are the public, the health facilities that are suitable for them to go to?
Thank you for that question. Primary health care actually provides care to the individual closest to them. So even though we're in an urban center, the practice of primary health care means that if you are ill, you go to the primary health care center nearest to you. If the primary health care center cannot manage your condition, then you'll be referred to the secondary health center. And it's only after that that you'll be considered being sent to the tertiary health center, either at the State Teaching Hospital, the Federal Medical Center, or the Federal University of Health Sciences or Topo Teaching Hospital. So the nearest hospital to the individual is the best place the person should go. That's actually it. Some people, the teaching hospital is closest to them. Some a general hospital, some a primary health care center, some a private health center. Notwithstanding, once we have qualified healthcare staff there, the nearest healthcare facility is the best place to go to. And assessments will be made of the person, necessary tests will be done, and appropriate care will be provided for all the problems the person has. So the best place to go to is the nearest health facility. And sometimes it may look like, no, but the other one is better. When you're talking about emergencies, you really understand why the nearest health facility is the best. So all our health facilities need to be equipped optimally so that we can reduce morbidity, that's disease burden, and also deaths, mortality from diseases.
All right. When you mentioned going to every available health center, at the primary healthcare level, for instance, are the health personnel there adequate with the knowledge to even detect that this is a kind of situation one is presenting at the facility? Is there any such possibility of then having the awareness of this is the kind of condition one has presented?
Thank you very much, sir, for that. When there are outbreaks like this, one of the critical pillars is actually capacity building of the healthcare staff. And it's an ongoing thing. So monkeypox, understanding of the symptom complex, management, and referral pathways is something that all healthcare workers will be trained on an ongoing basis. So once there's an epidemic, because the people who are managing it are actually people who are the frontline health workers. So these people need to be equipped. So the materials to work with and the requisite knowledge to take care of patients. So that is something, and that's actually done at multiple levels: the federal, the state, the local government, and the community level, to ensure that we don't lose any problem. And I'm sure that that's also something that, not I'm sure, it also can be improved, not just staying at the level we have now, including equipping, not just giving the knowledge, but also equipping. However, a healthcare staff that is equipped with knowledge also knows their limits and knows when to refer to and exactly where to refer to for the client to get the best care.
All right. Hello, good morning.
Good morning, sir.
Welcome.
Thank you. My name is Igbaye Makwa, regional person from Bachiagbo government.
All right.
My regards to guests in the studio.
Thank you. Please speak to us.
Okay, I have been listening keenly to the topic of the day, and I thank this radio station so much for the wonderful work the moderator has been doing in terms of sensitizing with the general public. I want to chip in here a little bit that let us imbibe, those of us that are listening to the radio, let us imbibe the habit of washing our hands regularly in terms of whenever we touch any object and anything that we do, let us wash our hands before touching any other person and eating. And I want to ask a question. You have already touched part of that question. As it is eat like this, is there any training that has been given to the health workers so that they will be equipped themselves in such situation like this? They will handle very well, as in training and even drugs that are available in order to take proper care of these such diseases. That is my question. Thank you.
All right. Thank you very much, Igbeima. We'll respond to your question. The line is still open, 0814-335-9292. SMS line is 0912-699-9404. Hello, good morning. Good morning. Okay, Dr. Bito, please, you listen to Igbayima.
Exactly.
Address his concern before we engage with more people.
Okay. So thank you very much, Igbayima. Great perspective there about hand washing being regular. It cannot be overemphasized. And I join Igbayima to encourage all of us to wash our hands regularly and to teach everybody we come across to wash our hands regularly. Very critical. We can prevent more than 50% of the infections that we come across strictly by washing our hands effectively. For the training of health workers, it's actually an ongoing thing. And even in Benue, health workers are being trained, and currently the frontline health workers, that's the mandate of our president, to train over 120,000 health workers countrywide. And for Benue State, from the 26th of August, the health workers, frontline health workers in Benue State are going to be trained on an exhaustive package of care provision at the primary health care level, including monkeypox. So, training of health workers is ongoing, and I'm sure NCDC also has their own package for also strengthening the response at the health facility levels, strictly on monkeypox. So the one I spoke about earlier is actually all-encompassing, including monkeypox. But I'm sure there will be a strict package just for monkeypox to ensure that care is provided at all our primary, secondary, and tertiary facilities at the optimal level for care for monkeypox and all other disease problems.
All right, so training very, very suitable, and we're happy that if it is being done, particularly healthcare workers with the adequate knowledge to handle the situation. But again, in our rural communities, how will the information get to them in terms of the prevailing monkeypox being spread already?
Thank you very much, sir. For spreading feedback at the rural communities at the community level in all the local governments, there are channels. And the same channels we use to share feedback for Ebola prevention and control, for COVID-19 prevention and control, are also available for effective feedback on monkeypox prevention and control. And the State Public Health Emergency Operations Center, through the Risk Communication and Community Engagement pillar for emergency control, will actually activate those systems, ensure that they cascade effectively so that down to the community level, feedback is provided. And all the logistic support is also provided. If there are needs that need to be met, the PHEOC would also reach out to the State Ministry of Health and all the other bodies required to provide the support to ensure that community engagement is optimal for monkeypox prevention and control.
All right. Good morning.
Good morning.
Please move away from your radio set or turn down
Okay,
its
I've
volume.
done that.
Yes. Welcome to the program.
My name is Peter Oku, the father. I'm calling from Oloku, Boko, Appa local government.
Peter who?
Peter Oku.
Okay, Peter Oku. Thank you so much. Hi,
Yes,
Boko this morning.
Popularly known as Oku, the father.
Okay, thank you. You say you are reaching
I
us from
love your program.
Thank you. You say you are reaching us from Ogbokbo?
I'm reaching you from Oloku, Uboko, Appa local government.
Okay, thank you so much. We are listening to you, Peter. Go ahead.
My advice is, we are talking of washing hands. There is an alcohol that we used to use in rubbing hands. I'm advising everybody to go to shop, to go to chemist and buy your chemical so that anytime you wash your hand, you rub it. Because monkeypox is real and we have to keep ourselves neat from dirty. Thank you.
All right, thank you, Peter. Thank you very much. All right, that's Peter. Okay, he mentioned use of hand sanitizer, where I think it's a common thing that has always been there. Hello, good morning. Good morning. Unfortunately, you are not forthcoming, and we connect with you, but the voice is not coming up. 0814-335-9292. 0814-335-9292. Hello, good morning.
Good morning, Agate Radio.
Warm greetings to you. Thank you for calling in.
Thank you. My name is Agate. I'm calling from Achuka.
All right.
I just want to say a little thing about it to my own knowledge.
You just want to say what? Tefa, we didn't hear. Yes.
Yes, I just want to add a little thing about the contribution.
Okay.
Of my knowledge. We have so many meat dry meat we eat in the market now, they are affordable to everybody that wants to eat meat. But we don't know the kind of meat we are eating because they are dried and in pieces. So we can't even recognize the meat and or know the kind of meat we are eating. And ideally, we have many animals that we don't have to eat them. So some of the things like that provide such things because there is hungry in rural villages. So they kill any kind of animal that they know that is alive, has meat. Then they be able to stay in the market, of which there will be no head. There will be nothing to recognize the meat, but we have dry meat. Thank you, sir.
Okay, thank you. Thank you very much,
Thank you so much.
Aki. Okay. The experts has not told us which of the meat specifically to avoid, but he mentioned having to cook it very well. Good morning.
Yes, good morning. Eddie.
The name is who?
Eddie.
Could you speak up? You sound inaudible.
Hello, Eddie from Northbank. Eddie.
Eddie who? Tell us your full name, please.
Eddie Obande, calling from Northbank.
All right.
Yeah, so I've seen that over the years, these varicella zoster, I'm talking about, and chicken pox, is mostly deadly in adults than children. Like even me, I had chicken pox earlier this year, and it even affected my palms. So, and some children have seen that it didn't get up to that level. So my question is, does the effect of this chicken pox, does it depend on the age of the person? And who is more prone to getting it, children or adults?
Obande, are you listening?
Yes, I'm with you.
We are discussing monkeypox and not chickenpox anyway.
Yes, I know that. That's what you're discussing. I know, but I'm just comparing it to that. Who is more prone to getting the disease, children or adults? Or it doesn't? And does it depend on the age? Does the effect it has depend on the age?
Okay, all right. We'll allow the doctor to respond to you. Thank you, Eddie Obande. Thank you. All right. Please respond to Eddie Obande pointedly before we engage with more people.
Thank you very much, Eddie, for asking, based on your personal experience. The chicken pox, usually when children or people are growing up, there is a chance that they get exposed to the virus, and they come down with the symptoms, the rash over the body, and the other associated itch, the probably fever and aches. When somebody does not have it at a younger age, and they have it at an older age, there is also a chance that the symptoms may be more. It's not, it's not a thing like say, in adults, the symptoms must be higher. No, but there's a chance that there'll be more when an adult comes down with it. That when children come down, the symptoms are relatively mild, something like that. And then sometimes people also take some antiviral medication that reduces the severity of the symptoms. Yeah, so those are considerations for the symptom expression in children and adults. And also, I'd like to talk about what Peter said. Peter talked about the alcohol-based hand rub. We're concerned about affordability. So, water, when we say wash, people should wash their hands with soap and running water. Even if there's no pipe-borne water, someone having a cup with water and pouring for the person to wash their hands is close to, running water. Or water in a bucket that has a tap, that's close to running water. But the alcohol-based hand rub means that someone must put their hand in their pocket and spend money to buy something. And affordability for everybody is not the same. So we may not say everybody go and get a hand sanitizer. If someone is trying to use the money for something else that is of more concern to them than the alcohol-based hand rub or the hand sanitizer, we say go ahead and ensure you wash your hands with water, something that is easily practicable for everybody. And even for soap, if there's no soap, potash, when we cook, the remains after the firewood has burnt, that ash can also be used as a substitute for soap. This appropriate technology I'm talking about. Thank you.
It's okay. All right. especially for in this economy where
Oh,
it may
yes.
be a bit difficult for some households to even afford it. So let's take some messages before we come back. Peter Luke on our live feed on the live stream feed says an interesting topic. I have now known more about monkeypox disease caused by virus. More grace to keep this sensitization process. All right, thank you, Peter Luke. That is from our live stream feed on Facebook. And in our SMS box, good morning, Nathaniel, and your guest in the studio. Since the medical doctor said monkeypox could be transmitted from animals to humans, especially those that work in the restaurant, butchers, and the zookeepers, I will advise that these category of persons should try to always wash their hands after handling meat and other live animals to avoid being infected by the disease. Vincent Akko from Wadata. Okay, Vincent, thank you very much for your message. Hello, good morning.
Hello, good morning.
Good morning to you. Hello.
I'm calling from Hilo.
Okay, your name is who?
Uta. Elder Uta.
Pius Uta?
Yes.
Okay, thank you, Pius.
Yeah. I want to appraise the program. It's very good.
Thank
very
you.
Good campaign. That for those of us who are hearing you
Sir,
on the radio,
may you
we are
move away?
getting the message.
May you move away from your radio or turn down the volume so we can hear you better, please?
Okay, thank you very much.
Okay,
Yeah.
we are listening to you now.
But then what are, the people in the rural areas, it's very good for them to hear this campaign too, because they don't know. They don't listen to radios, and I think if health workers are sent there to educate them, it will be better. Okay, like now, Goma has been talking about open defecation. The people in the village doesn't know this. Up to today, you see, go in the villages, they are defecating outside. Nobody goes to get a toilet. So all these complaints are taken. They are taken to them. It will help. So I think we will do well to let this message get to the grassroots as well, and it will help.
Okay, thank you. Thank you
very, very much.
All right, thank you for calling in. Well, sometimes when people say those in the rural areas don't listen to radio, we may tend to disagree, because here on Agate Radio we take calls from rural communities. So it's affirming that our message is reaching. But that is not to say the sensitization should not be stepped down by the healthcare workers, because what we do on radio may just be a fraction of it. All right. The line is still open, 0814-335-9292, 0814-335-9292. The SMS line is 0912-699-9404. Good morning.
Hello, good morning, sir, Nathaniel.
Good morning to you.
Yes, my regard to the doctor in the studio.
One regards to you.
Thank you very much. This is Vincent Ako calling from Wadata.
Okay, Vincent, we're listening to you.
Okay, from what the doctor said, it looks as if they are the same symptoms. As in, it looks as if a monkeypox and leprosy have the same symptoms. Is there any difference? Because he was talking about rashes and the rest. So is there any difference? That's what I want to know, sir.
Okay. Thank you, Vincent. Thank you. Doctor.
Yes, sir.
Do we still have leprosy?
So, Vincent Ako, thank you so much for your question. Answer, yes, we still have leprosy. Leprosy is a disease of antiquities, an old disease, ancient disease. Unfortunately, leprosy is still real, even here in Benue, sir.
Okay.
So, Benue, we have leprosy.
All right. But Vincent's question, anyway, that was my own side. Vincent's question is,
yes,
leprosy also is accompanied by rashes. How
Yes.
does one get to differentiate between the rashes of leprosy and monkeypox?
Okay, thank you very much, Vincent, for that question. For monkeypox, it's usually a rash that starts at the face and then goes to other parts of the body, including soles and palms. However, and then the other symptom complex like fever, body aches, weakness, swellings of the lymph glands. But for leprosy, what we usually have is something like a patch of skin that is different from the regular, and then areas where the person does not feel, absence of sensation. Okay. For monkeypox, absence of sensation on the skin is not a classical feature. So that can be used to distinguish very clearly between monkeypox. And then in leprosy, you don't have a classic rash that starts from the face and goes to other parts of the body.
All right, so Vincent, I believe you are interested in knowing about leprosy. we, we have availed you the information. Good morning. Hello. Oh, unfortunately, we lost connection with the caller. Okay, doctor.
Yes, sir.
Public health emergencies generally we have them recurring. But before I land on the question, let's engage it briefly. Good morning.
Hello?
Good morning.
Yes, good morning. Yes, this is Ed again. My question was not answered. I asked that from the number of recorded cases now, who did it affect the most, children or adults?
Okay, thank you. Thank you, Eddie. All right. Public health emergencies, as we were talking about, generally, what should be the best protocol to handle them when we have them emerging and emerging again?
Okay, thank you so much, sir, for that question. When we talk about public health emergencies, the best way to handle them is strengthen the health system and improve capacity to respond in seconds. What do I mean by that? The Public Health Emergency Operations Center is actually like your military, your Air Force, your Navy, and your ground troops. Okay? These are your troops with respect to health. And the enemies we are fighting are all the infective agents, from the viruses to the bacteria to the fungi to all the different, even prions. So to fight these, you need an entire retinue of resources, manpower, capacity building, and resources. So what that means is, if we're having epidemics back to back, or public health emergencies or international concerns back to back, it just helps us to say that we must build back stronger to actually win the war against these microbes. The microbes are getting wiser. The microbes are understanding our body systems better. They are understanding the medication that we take better. So to fight them, we must be smarter. That means the entire EOC is functional. It has 24/7, 247 activity, not that 4 p.m. close, no. Shifts throughout the day and is replicated at the local government levels. It doesn't just stop at the state. Logistics are available, vehicles are there, laboratory personnel, consumables required to collect samples, to test. Also, the laboratories to provide the testing are close by. If not available, then labs are built. It's critical to respond to public health emergencies immediately and promptly, because delay is very dangerous. Sometimes a delay of 1 hour can cost you many lives. So we need all that. And if we're having this back to back, then it means that for the last epidemic, what challenges do they have? We resolve all of them before the next epidemic. And when the next one comes, we start thinking out of the box. What do we need to do based on hindsight, what we have from the last one, so that we don't have morbidities. If someone needs to spend only 1 day in the hospital, they should spend 5 days. It shouldn't be something that you even consider even having one death, provided we intervene when we should with the entire barrage of resources concurrently.
All right. And I'll request you to speak briefly on Eddie is insisting that we did not answer his question
Okay.
whether between children and adults of the cases confirmed who amongst the categories of persons. Just a brief comment on that.
Thank you so much, sir. Generally speaking, diseases, we have people who have lower immunities being more prone. And these people include children. Like for monkeypox, you have, for this current outbreak, more are actually among children between 1 to 10. And then it reduces as age increases. And we're aware that their immunity is not as developed as those of adults. Remember that also some people who have compromised immunity include those who have cancer, pregnant women, and others who are on medication that compromises their immunity. So these people, when a disease-causing agent affects them, they are more likely to succumb as compared to other members of the population. I'm also sure that Eddie will be interested in knowing which gender is also affected more. It's males. Males are 70% more, 70 males, 30% females in the affectation of this current outbreak of monkeypox in the country.
All right, so Eddie, I believe you may have gotten exactly maybe what you wanted. Doctor, we are out of time already, so I'll request you to just give a wrap-up of concluding thoughts in 1 minute.
Thank you so much, the Anchor and Agate Radio, for this excellent opportunity to share thoughts about monkeypox. The conversation should continue. Everybody, please share feedback. Help every other person to know the problem of monkeypox, how to prevent monkeypox, hand washing, personal hygiene. If one is infected, not infecting others, using a face mask, staying isolated so that you don't affect others, and also keeping our personal effects, away from others so they don't get infected, and not handling touching surfaces or touching things that we don't need to, so that we don't expose others unduly. And please, for those who are not obviously affected, please ensure that you wash your hands always. Stay safe. And meat handlers, food handlers, please, personal hygiene is very, very important. Thank you so much.
Okay, this is our program, which will conclude today. Dr. Teka Bito is a consultant public health physician at the Benue State University Teaching Hospital. He is a chairman, Association of Public Health Physicians in the state. Thank you very much, Dr. Bito, for coming on Perspectives.
It's my pleasure, sir.
All right, join us next week, Monday, for another edition of the program. Have yourself a great weekend and stay safe. Remember, prevention is better than cure, so be guided by the advisory you've been given by the doctor so that you will not come down with monkeypox or any other disease at all. My name is Nathaniel Nongo. I'll see you Monday.